India sets another grim record as global cases top 150 million. Crematoriums are overwhelmed and the health system is crumbling. Anger towards Prime Minister Narendra Modi is also growing as India's death toll has now passed 208,000. Amid all this, the first batch of aid from the U.S. has arrived and hopefully bringing some relief to the country. To discuss this further, we're now joined by Leher Sethi, who is from New Delhi in India. Good evening and thank you so much for your time tonight. Certainly a difficult situation that is currently unfolding in India. One of the doctors was, really telling a news channel that it is, and I quote, nothing short of an apocalypse, when you look at what is exactly happening in India. Would you agree with the statement?
I would. I would say that things are extremely bad in India right now. And it is a very scary situation to be in. And it is in many ways a lot like an apocalypse.
Paint a picture for us, because when we keep on seeing different reports, we're seeing, really an overwhelmed system and people that are so desperate that they're even queuing on the side of the roads in order to be able to get access just to some kind of oxygen. Paint a picture then, as a resident there in New Delhi, how things are looking on the ground.
So things are very dire on the ground. The images that you have seen have also been coming to us. And although, I'm not stepping out, but I am keeping in touch with various volunteers who are out there. I am also in touch with people who are going to hospitals. There are a lot of calls that are coming in. People are desperate, the desperation and the struggle begins from the moment that you need to get yourself tested, because there is a shortage of even RT-PCR test kits with the labs. So first, it is quite a struggle to get someone to come and take your test so you know whether you're positive or not. Then it becomes, in case you do not, your case becomes bad enough for you to need oxygen, for example. It is very difficult to get hold of a cylinder. It is difficult to get hold of, someone to go and actually get that cylinder filled with oxygen. And then if you need hospitalization, then it is very difficult to get a bed in any hospital, be it private or government hospital. If you do manage to get a bed, if you only need an oxygen bed, then even the hospitals are facing shortage of oxygen in New Delhi and in other states as well. So even then you're not safe, or you're not cushioned really. In case you need an ICU, there is a major shortage of ICUs. So if your condition is really bad, it is very difficult for you to get an ICU. And there is even a queue outside cremation grounds. It's very difficult to get cremated as well. I lost a friend, a dear friend, a senior from college. He did not die from COVID. I'd like to specify that. But to find a cremation ground that was willing to cremate him, to find an ambulance that was willing to take him, was so difficult. We had to keep his body overnight in a place with air conditioning. It's like living a nightmare. It is very, very scary.
And from what you're describing then, and even healthcare workers who are also crying about, suffering from fatigue, would you say then that the system is at breaking point?
Absolutely. I feel sorry for the healthcare workers. I have been in touch with a few because we have been trying to coordinate efforts and send patients to various hospitals. And, we've been calling on helplines. We've been calling on their phone numbers and trying to get to know whether beds are available and sending people there. So most of the doctors that I've spoken to, even the hospital administration that I speak to, they are under tremendous stress. And a lot of times they also call us, there are SOS calls that come to us saying that hospitals are about to run out of oxygen supplies in 2 hours, some say 3 hours, some say their tankers haven't reached and they're worried about it. So they are under a lot of stress and fatigue. and and I cannot even imagine the kind of mental agony that they must be going through because they're away from their families as well. Yeah, it's.
And 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 when you look then at this situation, and some really continue to blame the Prime Minister here, saying the handling of the situation has not been great. What do you then say as a resident of New Delhi when you're looking at how government has been handling this crisis?
So I have said this many times. I feel that they did not heed caution. They did not take the right measures at the right time. And maybe had that been done, we would have been in a much better situation. And I truly believe that. We were not prepared. We were caught off guard. Could we have prepared? I feel that we could have, for sure. But now we need to look forward and think of something to, do and obviously make the situation better. But even now, I feel that accountability is majorly missing. I was looking to find myself a slot for registry for getting my COVID vaccination done tomorrow, since I've already registered for it. And from tomorrow, our country was to start this massive vaccination drive, but there are no slots available on the website. So obviously that does show you that there have been major gaps in planning and execution, and things could have been handled a lot much better. I believe we've exported, sold and donated over 66 million vaccinations to the rest of the world. But now we do not have vaccinations for our own citizens. And as a citizen, I do feel strongly about that. And I do feel that I've been let down.
And when you then look at, the situation that is unfolding in India, others have said that there shouldn't really be much concern about what is happening because, India is not here. It's a country that's far away, not here in South Africa, not here next to any other country. But certainly the world should sit and pay attention because this can happen anywhere. Why do you think this crisis then matters to the rest of the world, and the fact that India should be assisted in the most way possible by any other country?
I think in India we believe in Vasudev Kutumbakam. The whole world is one, and we're all a family. And I really think that in today's day and age, you cannot really be isolated from the rest of the world, no matter what country you are. So any country that is in a situation like India is in right now, I'm sure that the other countries would want to come forward and to help it. India being, I don't think that India is a weak country at all. We are the largest democracy. We are the largest producer of vaccinations in the world. We're the third largest pharmaceutical producer in the world. We are one of the largest military powers. We're a large economy, the fifth largest economy in the world. We've got 140 crore people. And despite all of that, there are people here who are dying of something as basic as oxygen shortage, not having the right infrastructure in place, not having medicines for people, and I think that is very unfortunate. It's not that we did not have resources or that we do not have them. It's just sheer lack of being prepared and lack of planning.
And as a final question then, when you look at reports that suggest that India declined the assistance offered by the UN of its integrated supply chain for COVID-19 related material. The country says that it has a robust system to deal with the required logistics. And this is, of course, what Antonio Gutteres had to say when it comes to this particular situation. Do you think this was a wise move by the country?
No. The answer to that is an absolute no. It was, it makes me so angry as a citizen of India. It makes me so angry when I see people dying around me, when I feel helpless. I cannot arrange oxygen for them. I cannot arrange beds for them. I cannot help them with medication. That we have refused, that our country, our government has said no to foreign aid. when we need it. We do need it. And I believe that even though India has said no to the aid that was coming from the UN in terms of, their integrated system, they have agreed to take aid from America, and I believe some aid has come in today. And we are taking aid from other countries. Why they said no to taking help from the United Nations, honestly, I do not know. But we all know that Mr. Modi is extremely worried about his image. He is someone who places a lot of importance upon that. Going to the point wherein, to him, maybe his image matters more than the lives of his fellow countrymen. It's a very strong statement to make, but I don't see it any other way.
All right. Leher, thank you so much for your time tonight. Certainly a desperate situation that is really calling for an integrated approach in order to try and really resolve this crisis that is currently unfolding in India. The death toll currently standing at 208,000, and some significant developments, from that country in the past couple of hours. I mean, we saw 386,452 new infections today only, and also you're then looking at 3,498 deaths. That's only in the past 24 hours.